uniqueness of the St. Mary's program is it's the only one in the country. As a practicing gerontologist, I had a practice where I was the medical director of a number of buildings. And we noticed that while there was a great deal of attention being paid to wound care, to pain, to general clinical conditions, the level of suffering that was engendered by psychiatric issues was only marginally approached. We are a very much aging society, and the prevalence of geriatric population as users of healthcare is also obvious. We know, for instance, that dementia and other neurocognitive diseases in the geriatric population over time reaches almost epidemic proportions. What people generally don't realize is that if you reach the age of 65 in America, you've got approximately a 30 to 35% probability of having dementia before you die. And if you're going to care for this population, it's incumbent on you to have a robust understanding of this. So much so that it actually creates its own specialty opportunity.
St. Mary's has been key in helping us to disseminate our evidence-based care, whether it's through our research, bringing in research leaders from across the country, but the idea of bringing evidence-based care and allowing us a platform to be able to teach this, they have joined with us in the passion on seeing the need for this.
The leadership, I think, is a critical piece for all levels of our students because they need to be able to go out there and make change for the best for our patients and then for the communities too as well.
The relationships built with the faculty here are lifelong. And I knew when I graduated that my degree would represent the highest academic standard.
It is awe-inspiring. When you go downstairs to the simulation lab, you feel like you're either in a doctor's office or a hospital. Coming here, doing immersions, being down there and practicing lets me transfer that over into my clinical practice, and I'm already comfortable.
There's a need for individuals who have specific training and understanding of this population, of their clinical needs, and of the protocols that really are best utilized to help them. So there's a tremendous need, one, but there's I think even a greater issue is the ongoing need for specialized training and understanding of the unique differences of this population.
Everything that we do in healthcare is oriented to human flourishing now, in the present. And that includes people who are at the end of life. That includes people that are even dying. When we care for the dying, we're caring for someone who's alive. And we want them to flourish in the time that they have left.
We know we can't cure dementia, but we can make that journey for these people and their families easier. So it's going to be exciting for us to be able to finally share findings from our research, the way that we see healthcare shaping for this population.